Good afternoon. Thank you, everyone, for joining again today to disseminate information to Tennesseans. A very important thing that we do to make sure that folks know exactly what's happening day to day as we face this COVID-19 issue in our state. I want to just start off by making a couple of comments about how encouraged I am by the way that people are responding. I want to challenge people to continue to respond. I want to make sure that Tennesseans know that this is an individual responsibility of every single one of us to follow guidance and to take our own individual opportunity to engage in our community in ways that will help us get through this. And be assured, we will get through this. And we will mitigate this disease to the degree possible. We are going to mitigate the economic impacts to the degree possible. And we, Tennesseans, will do what it takes to find our way through very difficult days that face ahead of us. So be encouraged in that. I want to commend today, in particular, I just want to commend our healthcare workers who are out there on the front lines, who are putting themselves at risk and who know that's what they do every day, but who are helping us to do those very things, which is to mitigate this disease. And I also want to I've been encouraged. I've been encouraged to see individuals step out. I've been encouraged to see businesses find alternative ways for their employees to be safe. I've seen the private sector stand up remote testing facilities in the healthcare industry. We've seen churches learn how to worship and nonprofits learn how to serve in alternative ways. And we've even seen some Tennessee companies be very creative. Dollar General has a period of time for elderly folks to shop in their stores. The elderly are the most vulnerable in our population, and finding ways to keep them safe is the way we do things in this state. I've got to share one more. Corsair Distillery here in Nashville, who produces gin in their distillery. They have paused their production of gin in order to produce hand sanitizer that's available in their stores. That's a Tennessee example of how we step up and we adapt and we reach out to help in our efforts all together as we move forward to accomplish this, and we will. Today, as of today, we have 154 confirmed cases of COVID-19 in Tennessee. I want to give several updates from our time yesterday before I move on into my remarks today, talking about Executive Order 15, which I just signed. Yesterday we talked a lot about small business and the backbone of our economy. We announced the effort that we had made and secured SBA Small Business Administration loans for small businesses amounting up to $2 million per small business in this state to help companies that are negatively impacted by the COVID-19 virus and the subsequent economic damages from that, to help those companies secure loans for the period of time of transition. Today we want to confirm, because we've talked a lot about what nonprofits can do to help, but we want to confirm and reach out and communicate to those nonprofits that these SBA loans are available to nonprofits as well. So many of them do remarkable work and they have a struggle through this period as well. So we need to make sure that our nonprofit agencies understand that the SBA loans that we've secured are available to nonprofits as well. Yesterday we talked a little bit about medical capacity, and I want to put some clarity and context around some of the numbers. There was a request yesterday when we talked about ventilators. We purchased 570 ventilators yesterday. So to put that in context, we currently have 537 unused ventilators. Of course, that number changes up and down a little bit every day, but we have about 530 unused ventilators in our state, and we've ordered 570 yesterday. So that gives you a bit of context around what is a lot of ventilators or what is a required amount. Now, let me just say, we're still continuing to pursue ventilators, even though that's doubling our current capacity, because we want to get ready in case there is a surge. I was on we had an encouraging piece of information around ventilators and other medical supplies that I'll talk about in a second. But I was on a phone call with the President, the Vice President, and 50 governors today, talking specifically about medical equipment. We talked about a lot of things, but the federal government has changed the ability for us to use and to convert ventilators that would traditionally be used in an outpatient surgery center to convert those to ventilators that can be used in the COVID-19 situation. So what that means is that we have access to tens of thousands of ventilators across the country that will be available for this conversion. But what it will require is that we have access to those through the providers that have them. So there are outpatient surgery centers, for example, and hospitals in our system that utilize these ventilators because they are in the process every day, day in and day out, of having elective surgeries and elective procedures. So today on the call with the President, he asked every governor to ask every medical provider, every outpatient surgery center, every hospital in their state to suspend elective medical procedures and elective surgeries to free up medical supplies, ventilators, and healthcare workers that would be connected to those elective procedures and surgeries. And we're reaching out broadly to the healthcare community today to begin the process of creating greater access. Yesterday we talked about hospital beds. We wanted to put clarity around numbers there as well. We estimate we have approximately 15,000 licensed unused beds in our health system across Tennessee. Now, to put that in context, we have about 12,000 people currently hospitalized in a bed in Tennessee facilities today. So we have more than double the capacity of beds available. These are licensed beds. The challenge for that, and what we'll have to address going forward, is staffing for those beds. So we feel encouraged about the number of beds available. We're now working on staffing, and I'll talk a little bit more about that when I discuss the executive order number 15. Medical equipment includes, and one of the challenges that people have seen across the country are the access to things like surgical masks. So today on the call with the President, he announced that they had lowered or they had lessened their restrictions. Basically what they've done is for surgical type grade masks that are not surgical masks but are actually used in industrial settings, they've allowed and loosened the regulations that allow us to use industrial-grade masks for surgical procedures around COVID-19 and or for medical procedures around COVID-19 and testing. Basically what they're doing is changing the regulations around masks that frees up tens of thousands of masks across the country, and we are beginning already in our office to pursue procurement of additional masks that can be used in setting for treating and testing COVID-19 patients. These are all fast-moving developments around medical supplies, but every single one of them is an encouraging development. It's encouraging, and we're finding that we believe that if we continue to work hard and we continue to mitigate the spread, that we can have a healthcare system that can meet the needs that we will have in the days ahead. Now, today I signed Executive Order 15 to relieve regulatory burdens and to free up our departments to effectively respond to COVID-19 here in our state. This executive order, it works to quickly boost our healthcare capacity, continue important consumer protections, and it also provides enhanced customer service to our citizens through this pandemic. There are a number of components to Executive Order 15. It's been distributed here. It will become widely publicly available. But I want to go over just a couple of the things that are most important about it to consumers and to folks all across our state. We have deregulated, through this executive order, we have further deregulated healthcare beds to free up capacity. There are beds in the system that the way they are described and regulated are not available for use in their current capacity for COVID-19. We are changing the regulations around those through this executive order that will free up additional hospital beds. We have deregulated what is called scope of practice so that more healthcare professionals can treat more patients. You know, there are limits on what healthcare professionals can do and the types of patients that they can treat based on the licensing that they have. So this executive order will temporarily free up that licensing regulatory environment so that more healthcare professionals can treat more patients in more ways. It also expands the number of providers that are eligible to work in our state through the use of technology and telehealth. Loosens regulations around that technology and geographic area, and it urges insurers to provide coverage of telehealth services to COVID-19 patients. So we want to encourage people to get health care treatment not by going to their doctor's office, but by being able to access that treatment through telemedicine. Now, there's legislation around telemedicine, but this is around the regulations about who can use telemedicine and how it can be used. And the details of that are outlined in the executive order, but it allows folks who might work out of state but can operate in this state to provide services through telemedicine. It allows that to happen. It loosens up regulations around HIPAA regulations so that folks can use alternative technologies like Facebook or FaceTime to not Facebook, but FaceTime, to access medical services through technology. So there are a number of regulatory restrictions that have been lifted to allow for more healthcare workers to provide more services to more patients as this unfolds in the days ahead. We've also, through this executive order, put in place stronger consumer protections. You know, this pandemic has highlighted the way that Tennesseans come together, but it's also, and many of us have read stories about, it has provided opportunity for people to take advantage of a pandemic to their benefit. And while we earlier put in place law and penalties for those who price gouge around medical supplies, we have, through this executive order, extended those penalties to include those who price gouge and take advantage of consumers with regard to the food supply. So there will be new penalties associated with price gouging food and food supplies in this executive order. I want Dr. Piercy, the head of our Department of Health, to come up and make comments, but and then we'll have Commissioner Long make some additional comments around our suspended rules. We're going to be suspending rules. One other thing I didn't mention, suspending rules around driver's license renewals. So our driver's license centers are packed. We on a call today with the President, governors requested the federal government to extend the time frame that we have to get a real ID. We believe that will be coming soon. We want to suspend the requirement for folks for a 2-month period of time during this executive order. We want to suspend requirements for folks to renew their driver's license in that period. Commissioner Long will talk about that. So we'll open it up to comments in just one second, but I want to close this portion of the comments like I opened them. We will get through this. We're making tremendous progress. The federal government is moving rapidly to provide aid to states, and we are connected hourly to those through our federal delegation and to the federal government to make sure we're connected to that relief. We, as previously announced earlier, are providing targeted relief for families that are struggling financially as a result of losing jobs, those who will face health care dilemmas that they hadn't had before. We're working to strengthen services for the uninsured and for the insured through provisions with insurance companies. We're working hard in state government 24/7 to address the great challenges that lie before us here. But the people that are actually going to do this, once again, are those of you out in your communities individually who are taking responsibility to socially distance, to stay home when sick, to help an elderly neighbor, to follow the mandates and the guidance and the responsibilities that each one of us hold to address this challenge, and I know that we can do it. Dr. Piercy, would you come up and make brief comments regarding the status of where we are on the health side of things?
Thank you, Governor. Thank you, everyone. As the Governor mentioned, our case count today is 154. That does represent the largest day-over-day increase that we've had. But I want to remind you that's because we have an increase in testing availability. We're still struggling in some areas to get the supplies that we need, particularly PPE, personal protective equipment, that the Governor referenced. But the news that we got from the White House just within the last hour or two will significantly help that effort. Of those 154, right at a half of those come from Davidson County, and we now have cases in 17 different counties. Up from yesterday, we have approximately 15 hospitalizations that we are aware of now, but no deaths. With increased testing becomes the need for a directory. And so you've probably noticed on our website we have a link called Remote Assessment Sites. And when I checked just before coming in, we are now up to 40 of those listed. I do want to remind you that the department is serving as a directory in that. And when we're given information on that, we upload that just as soon as possible. I also want to stress something else in that is that they're called Remote Assessment Sites. It's really important to make that distinction because not everyone that presents for assessment will be tested. You've heard me talk repeatedly about who meets criteria for screening, and that is because there are only a certain amount of people that present for assessment that need screening, and we are prioritizing healthcare workers, those over 65, and those that are hospitalized in our prioritization for testing. Finally, I do want to applaud the Governor's efforts for telehealth in the executive order. This will not only allow us to provide care for those who have been affected by COVID-19, but for conditions, particularly for patients who don't need to be out and about. This does a couple of things. It helps us to provide that access for patients while they can stay in their home, as well as it helps protect our healthcare workers. And as you've heard him say many times, and that you will continue to hear us say, our healthcare workers are key in this response, and so we want to do everything we can to protect their health and keep them in the workforce. Thank you.
We also have Dr. Dunn with us from Department of Health, who, when we do Q&A, we'll ask him to provide answers if needed. I wanted to ask Commissioner Long to come up. And because I announced a few minutes ago that we are going to suspend the requirement for renewing driver's licenses in our driver's license centers. Everybody's a doctor up here, except for me and you. So, but would you come up and give further comments about that, and then we'll open it up to questions.
Thank you, Governor. Good afternoon. The Department of Safety and Homeland Security is implementing changes. We're trying to ensure that people do not have to come to our DL centers. We are staying open to serve the public, but are not forcing people to come into our centers. We first want to encourage all the residents of Tennessee to renew a driver's license by using the online e-service portal at www.tn.gov/safety. Again, that is www.tn.gov/safety. The announcements that the governor has made today, effective immediately, the department is waiving the requirement that citizens have to appear in person to have a photograph taken. If your license is about to be renewed and you are to come to a center to have your new photograph taken, you do not have to do that. We are waiving that requirement, and that will be waived until October the 1 of 2021. Now, non-U.S. citizens and people who have a temporary driver's license, a Class XD or a Class X ID, will have to appear in person to renew those licenses upon the expiration of the current license. Also, all driver's license, our learning permits, our commercial driver's license, our photo identification license, IDs, and handgun carry permits that expire between March 12, 2020 and May 19, 2020 will be extended for 6 months from the expiration date of your license. We, the department, will issue a letter of extension to you and mail that to you automatically, and you will be carrying that with you and required to keep it with you to present in the needs you need to show your driver's license for identification. In compliance with the recommendations of the Department of Health and the Centers for Disease Control, we are cleaning and sanitizing our driver services centers and equipment across the state. We're also beginning a process where we are going to station a staff member at the entrance to each driver services center. That individual will ensure that the number of customers entering our center does not exceed the CDC recommendations. We're going to encourage and allow customers to wait in their vehicles at the department sites, and we will use what's called e-ticketing, that we will give you a ticket, and we will get your telephone number, and we will text you and call you and let you know at the time you will enter the driver services center in our effort to prevent the number of people gathering inside the center. Also, we want to encourage all high at-risk customers to use the online services for renewal and also for duplication transactions. We're also going to encourage our customers, if available, to use credit and debit cards as much as possible to prevent the limiting handling of cash. Our service centers, I want to compliment our employees. They are facing difficult times right now with the virus, but they have done a fantastic service, and they're excited to also serve all the citizens of Tennessee. Thank you.
Thank you, Commissioner. That wraps up this portion of the comments. Let's open it up for questions. Jonathan.
I know one of the things that the government actually were asking about was maximum flexibility to use the National Guard. I was wondering how that went over on the call, and what specifically would the National Guard be used for, and is that something we're looking into?
So we're actually utilizing our National Guard already. They are. We are working with them to develop a plan, and they're already executing on that plan to staff testing centers and to deploy deploy is not the right word, but to employ their medical personnel that exist within the Guard to help us with the process of testing and subsequently down the road with treatment. But the request from governors to the president was to provide an alternative to the way currently it's funded. So our National Guard is funded not entirely by the federal government, and this change in funding will give us more flexibility because it gives us more funding to call upon our National Guard in a greater way. We have not called the Guard into deployment here. We've not, into action here. We've not called the Guard up, but we are utilizing our National Guard. So it really was just a request to the President, and he said that he would consider that request for funding and make that request if there were enough of us that want it.
Some of that be like to keep the peace potentially or something like that?
Well, we don't anticipate the need to keep the peace. We anticipate the need to have resources in facilities as healthcare needs rise. So, our guardsmen are professionals who serve in the private sector in many ways all across the state. So they could be used in any number of ways. In fact, a lot of our guardsmen and the men and women that serve in the Guard are medical professionals now serving in the private sector in the medical profession. So we want to keep them there, but many could be used in other ways. So the National Guard will be an important part of ramping up our services in the days ahead. Joel.
Governor, several other states have taken a different approach and closed driver's license facilities. Why have you not done that? And we're going to have a couple other quick follow-ups.
Well, you mean close them as opposed to doing what we're doing today? Yeah. So we want to. It's a little bit of our approach to everything, which is to take the right approach to both maintain services and economic activity where possible, at the same time mitigate the spread of this disease. So what we really believe is that the adjustments that we've made will keep people from congregating. It will allow us to have social distancing, at the same time provide a level of service that is acceptable through this period of time, and take the vast numbers that utilize a driver service center out of the center. I mean, 9 out of 10 people statistically in that line are there to renew their driver's license. And if they don't have to be there, then we're not going to congregate large numbers of people. So that's the approach we've taken.
And then, Commissioner, can I follow up with just a couple of minor questions? Like, you talked about the CDC guidelines, but which ones are you referring to? The limit of 10 people in an area of 50?
Yes, Joel, 10 people within the center.
Okay, and then do you have a record of how many people are still coming to these facilities? I haven't been able to get out and see any myself, but are hundreds still going a day to facilities?
Our service is a little bit less than it was last week. People are being cautious, as the governor has asked, about coming out. It looks like that our visitors in our centers are down about 1,000 over a period of time compared to last week.
And then if you had to tell the residents of Tennessee right now whether they should continue to go to get their real ID, would you say don't do that right now? We're hopeful that the state and the federal government will relax that deadline? Because that would obviously ease a lot of drive, I'm sure.
Sure. Yes, we are encouraging people to wait. You have till October the 1st. Some states have not even starting to issue the real ID, so we're way advanced of them, of where we are right now. As the governor said, we've requested a waiver to the federal government, and we think hopefully that'll be successful. The governors have asked that through the National Governors Association. A lot of other states have put in that request, and we're hopeful that the federal government will delay the deadline of October 1st and give us plenty of time. Thank you.
More questions?
We've got Stephen over. Go ahead,
Stephen.
In Alabama, they've got less than half the cases that we do here, and health officials there have prohibited gatherings of a certain size and closed certain public spaces. I know you've continued to say you're encouraging people to take these actions, but has your mind changed at all on ordering anything like that?
Yeah, I think the best approach, and there are a lot of states doing it in a lot of different ways. I think the best approach is to encourage people to take responsible actions and to curb their activity, to comply with regulation. We've seen it happening in our state. We certainly can drive through downtown Nashville at 5 p.m. and it looks a lot different than it did 2 weeks ago. There have been things mandated in Nashville around bar closures, but restaurants are socially distancing. Companies are making decisions on their own to keep workers at home. There are Tennesseans and certainly Americans who are making choices. We see exceptions to that, and where those exceptions happen, I think, we bring them to light, and generally those change, those circumstances change. In our state so far, we've been really encouraged and haven't seen the need to mandate activity as much as strongly suggest activity.
I got a couple real quick. Have you heard instances of stores not restocking their shelves with medication and things like that? Is there anything the state can do on that?
Well, I have talked to the Grocers Association, who have assured me that we have a stable and secure food supply chain. So we have a stable and secure food supply chain. We feel confident that that is not going to change. Hoarding and panic buying disrupts that food chain and that supply chain, but it doesn't. It only temporarily disrupts. It just makes it very inconvenient for the people around those who panic buy. But we have no concerns about the continued stream of food supplies into our communities. Yeah, go ahead.
And assuming the legislature comes back June 1st, right now, permit miscarriage is off the table, and I believe the abortion bills are going about the wayside too. When the legislature does come back, will you continue to push for those?
Well, all legislation is, for lack of a better description, frozen in place. So all of the work that has been done, because the legislature is in recess, so any legislation that was in process through the committee process or any other process, it all stands in that same place whenever the General Assembly reconvenes. And so where any number of bills were, that's where they'll be when the General Assembly reconvenes. Yes?
Do you have any projections on when this might peak and how many people might ultimately become positive?
Yeah, it would be good, and there are a lot of folks that do a lot of estimating around that, but the estimates are so broad and so vast that it's impossible to know, and we don't know, and we're not really trying to guess. We are assuming and we are preparing for a scenario that none of us want, and frankly, we believe that by preparing and by taking the actions and the steps that we have, that we won't have that scenario of a massive surge and of a large percentage of our population becoming sick at the same time. The phrase flattening the curve is one that is very important when we think about the impacts that this will and could have on our society. But how that surge will happen, what that curve will look like, either in its duration or its intensity, is very difficult to know. We just know that the steps that we're taking will have some impact on the steep rise of that curve, and that's our goal.
Governor, you talked about this, I apologize, I just missed it. Education was such a big part of your state of the state, and I would just, obviously, the reason why. On the whole, how happy were you still that what you were able to keep in? And my follow-up to that would just be, if you're a family that feels like your child might be eligible for, to still get a meal at school while school goes, how do they know that? Perhaps they already know that.
Yeah, well, certainly we've done a lot of work. The question is, how about kids that are out of school and their access to food? We've done a lot of work to push that message out just about every day this week through these press avails. I've reminded people that as schools close, we put in place a mechanism to make certain that every kid that received their breakfast and or lunch from a school would continue to receive those. My wife today was working at Second Harvest Food Bank, packing boxes, because that's part of the process that will be utilized to distribute food in this region right here. Every kid will receive food through their school system. Now, the individual districts are reaching out to families as well, and they're developing their own unique strategies for delivering those food, those food supplies. But we feel confident in that process. It's happening all across the state, and any kid that was that received their meals through schools are going to get them through this time period. What was the first part of your question?
How would you assess all of the money that you were able to still focus on education, even though you had to adjust things like, teacher ready for the 2% assembly?
Yeah. It's disappointing, certainly for a lot of lawmakers who spent months and months and really most of the last year putting together what they think were really important pieces of legislation that were going to help Tennesseans and that were going to be good for our state, but that had fiscal costs to those, that had dollars attached to them, and most all of those have been removed. Certainly all of the all of the large pieces of legislation that were going to be substantive changes. We've passed some bills that allow us to continue to operate as state government, but and so much of some of the hopes that we had for legislation around education have been taken off the table for now. But the education of our children is incredibly important, and it will go right on when this is over, when our schools open back up. And that's why in our budget, even though we stripped it of a lot of future spending, we maintained fully funding the BEP formula to make certain that our public schools are fully funded in the coming year. We maintained teacher pay raises. We had to cut those teacher pay raises in half, but we are providing teacher pay raises through this budget. And we are continuing to fund any educational initiative that was passed and had a funding plan in previous legislation. So any initiative that was underway before this legislative session remains underway and remains to be funded through this. So let me just, and I'll say one other point about funding in the budget. You know, we did cut out a lot of funding, and we did cut out a lot of initiatives, but there's a time when it's the right thing to do to establish a budget that's going to ensure the fiscal stability of your state as it enters in what could be a difficult economic time. You know, these are hard choices, but hard times require hard choices. And that's what we did in this budget, and I feel really encouraged that we've done the right thing and that we've set Tennessee, we've not set it on a course, we've continued it on a course of fiscal responsibility for the year ahead.
We'll do one more in the room and then we'll open up.
Governor, it looks like the majority of Tennessee cases are occurring in younger demographics. Does that mean that younger people are not social distancing enough, or what do you get out of it?
Well, we certainly know that young people in general across this country are not as prevalent. They're not social distancing with the prevalence that others are. And part of that is because we know that young people are not as affected negatively by the disease as others. But that's part of the message and part of the encouragement that we got to get out there, reminding people that while they may not be as concerned about their own individual health and the impacts that it might have on them if they get this disease, and we do all know that the vast majority of people who get COVID-19 will have mild to moderate symptoms. The greater vast majority will not be hospitalized, and most young people will not. It can lead to an attitude that says, you know, it's probably not going to bother me and I don't need to be concerned about it. But why it matters and why we need to encourage young people to socially distance and to take personal sacrifice of independence for the sake of the good is that they may impact someone who isn't young, and their contact with other people may lead to COVID-19 in an elderly person in this community, and that could lead to a person's death. We not only are responsible for ourselves, but we're responsible for other people in this process, and we've got to continue to move toward behaviors in our society and encourage behaviors among young people and old alike to take responsibility in this.
We'll open it up for the phone real quick. At this time, we'll be opening questions up for those on the phone. If you could state your name and your outlet and then ask your question.
Jason Reynolds, Marshall's Road.
Go ahead.
Yes. Regarding the way the county case-by-case numbers are calculated, are these based on the county the person lives in, or is this the county in which the testing is done? Like, say, if you have somebody from Rutherford County go to Nashville for testing, do they show up as Nashville or as Rutherford County? And then how many people are actually in the hospitals? Do you know?
Yeah, this is Dr. John Dunham, a state epidemiologist. So those are good questions. And as with other reportable diseases, we list diseases by the county of residence. So that's how the Tennessee cases are listed. And you'll notice that we've started to stratify the information also by some cases that are out of state. We're in contact with those other states as well, so that they know about cases and potential contacts in their jurisdictions as well. And I'm sorry, would you repeat the second question? Dr. Piercy mentioned that earlier. There's 15 hospitalizations.
How many of these 154 are like actually in the hospital?
In each county.
We'll have to. We will have to check on the information about hospitalization. We get that information initially on each case, but we have to go back and backtrack to know when the patient is discharged. We know that some of them have been hospitalized and have been discharged, so we'll have to get the exact number.
Okay, thank you.
Let me make one more comment before we take the next question. There have been questions along the days about negative tests and reporting those negative tests. And the CDC is trying to gain information from the number of people and trying to find out how many states are testing how many people. So we have been requested to start the process of retrieving negative test information along with positive tests. It will take some time for us to move to that, but I just wanted to let you all know, because there have been multiple questions about negative testing, which the experts have basically said to date that it didn't provide meaningful data, but they're beginning to believe that if somehow we can track which states are doing how much testing, it'll give us a little better idea about how the disease might be moving through the country. So anyway, you will see in the coming days as we reach out to these private laboratories. Of course, much of this is not performed by the state, it's performed by private laboratories, but we're going to be beginning to request negative testing information as well. Can we have we'll take the next question on the phone line.
Marsha Lee with News Talk 94.1.
Go ahead.
Yes, do you have any information about the confirmed case in Cumberland County?
Marsha, this is Dr. Piercy. We don't provide patient-level data or county-level data due to patient privacy concerns.
Okay, thank you.
Next question on the phone.
Okay, a couple more in the room.
Governor, today attorneys for a death row inmate filed for a stay of execution in June, saying that the coronavirus has hampered the ability to sort of pursue interviews and things like that, and travel for their clemency and court hearings and that sort of thing. I was wondering if you thought that that was something that might be worth pursuing.
Well, that's certainly a decision of the Supreme Court, and they filed that request to the Supreme Court, so they'll be making that decision on whether or not that case should be put off.
We'll take one more, and then have to wrap up.
How is testing in rural counties going? Are they able still to get the same access that Davidson County patients might be able to get?
I'll let Dr. Piercy answer that more specifically.
Thank you. The question was about rural testing. We are continuing to encourage people to seek providers, their providers first, and many providers across all rural counties are able to have relationships with those lab vendors nationally that can provide testing. There's also testing available in some remote sites in more rural counties, although you will continue to see that grow, and our efforts are going to continue focusing on providing testing in non-metro areas, because as you correctly mentioned, metro areas are relatively well covered, particularly here in Davidson. Additionally, the health department is always available for testing as well as any patient information. But with any of those sites that I've mentioned, we always recommend that you call ahead so we can tell you, advise you exactly on who needs to be tested and where you need to go.
Thank you, everyone.
Again, thank you all for being here and for helping us spread the information. We will be back tomorrow.